Here are 5 things your OBGYN wants you to know about pelvic organ prolapse. Pelvic organ prolapse is not something we talk about frequently, and I think it's because there's a lot of shame and embarrassment surrounding what this is. I've even seen patients in the office really struggle and feel very embarrassed to bring it up. Now, I hope you never feel this way. This is something about your body and about your health, and you gotta let us know about it. There's also a lot of confusion around what pelvic organ prolapse is and the different kind of treatments that are available. Also, a lot of women think that pelvic organ prolapse is actually normal and a natural part of aging and getting older. Spoiler alert, it's not. Now, before I tell you the 5 things I want you to know, let me tell you what pelvic organ prolapse is. This is when one or more of the pelvic organs, so the organs of the reproductive tract, can actually prolapse and fall. This includes the vagina, the uterus, the bladder, the small bowel or small intestine, the rectum, and the urethra. The reason this occurs is because of a weak pelvic floor. If you're not following me on Instagram, which you should be, I did do a quick little 60-second fact video about pelvic organ prolapse, so make sure you're following me along on there. But essentially, your pelvic floor is supported by connective tissue, by muscles, and by ligaments. All of these muscles, ligaments, and connective tissue come together to hold everything up. But over time, those muscles can get weak and things can prolapse. So what exactly does this present as? This could mean that an organ starts to fall, and a lot of women, their main complaint is that they feel a bulge or a ball inside of the vagina. This could also cause women to start leaking urine or maybe even leaking some stool. It can also make sex pretty uncomfortable. So a lot of these things lead to embarrassment and shame and women not wanting to talk about it. It can make women feel very isolated and alone. But don't you worry, I got you covered. We're gonna talk about everything that you need to know concerning pelvic organ prolapse. Number 1. I promise you, you are not alone, and I want you to understand that. If you're experiencing these symptoms, trust me, you are not alone and you're not the only person or will be the last person to experience this. As a society and culturally, I think a lot of women have been told that, oh, you've had babies, you've had a vaginal delivery, it's normal to leak urine when you cough or when you laugh or when you sneeze. No. Can these things happen? Yes. Is it normal? No. This is not a way to live your life. It's not providing a good quality of life, so you need to bring this up with your doctor. As an OBGYN, I am here to help you, so if this is you experiencing any of those symptoms I listed, you need to go see your OBGYN. We can also place a referral to a urogynecologist. These are OBGYNs who then went on to do a 3-year fellowship where their specialty is pelvic organ prolapse. So there are resources, there are people out there who are more than happy to take care of you. Here are some numbers so that you know that you're not alone when we start talking about pelvic organ prolapse. 1 in 4 women in their 40s have this. 1 in 3 women in their 60s have this. And 50% of women in their 80s have pelvic organ prolapse. 50%. Yeah. Girlfriend, you're not alone. So what are some of the things that can cause pelvic organ prolapse? Pregnancy is one of them, although women who have never been pregnant before also do experience pelvic organ prolapse. Aging, as we age, muscles, connective tissue, everything like that gets slightly weaker. Increased weight gain or obesity can contribute to this. Any sort of connective tissue disorders, pelvic floor injuries, and maybe even sometimes having a hysterectomy can cause this. Also, think of anything that can increase your intra-abdominal pressure that's putting more strain on those pelvic muscles. So people who have disorders with a chronic cough like COPD, all the you use those muscles and over time it makes them weak. Anybody that is doing some consistently heavy lifting, that can also cause it. Or even chronic constipation. If you're just sitting there pushing and straining, you're putting a strain on those muscles. Number 2, pelvic floor physical therapy. I try and recommend to all of my postpartum patients, whether they had a C-section or a vaginal delivery, to pelvic floor physical therapy. We know that pregnancy weakens those muscles, so why not go see a pelvic floor physical therapist, someone who specializes in helping you strengthen that muscle and is a means to prevent prolapse from happening. Why not start early and get ahead of it so that you don't reach a place in your life where then you're just trying to find the solution? Anything that can provide preventative care is always going to be better. So if you haven't, I would reach out to your OBGYN and see if they can make a referral for pelvic floor physical therapy. They are incredible. Honestly, everyone should probably go see one. Number 3, symptoms may be different for everyone, so do not play the comparison game. Some women do have some sort of vaginal bulge, but it doesn't cause them any sort of discomfort or pain, and they're okay living like that. These are obviously not conditions that are going to quote unquote kill you or cause some sort of harm, but yes, they can be very, very uncomfortable. So if you're feeling uncomfortable and you're embarrassed and you want to get it fixed, or you need to talk to someone about it, please reach out to an OBGYN. But some women, it doesn't bother them, so they don't need any help. Like I said, sometimes this prolapse can lead to leaking of urine, and that can really decrease your quality of life. So please, this is not normal. If you're having to change out your underwear or your pads because you're leaking so much urine, this can then lead to other complications and skin irritation and infections, so please see your doctor. Some women may also have to splint to have a bowel movement, meaning they're very constipated and they'd have to place one finger inside of the vagina to help kind of move that stool out of the rectum. Again, not a good quality of life, so let us know. Number 4, treatment. Remember that symptoms are going to be different from person to person, so this is not a one-size-fits-all model. Some women just need pelvic floor physical therapy, and that's enough. Other women may need surgery, but there's a huge range of treatment. If you're at home and you're not really ready to see a doctor, try these things first and see if you notice some sort of improvement. If you have chronic constipation, drink lots of water and eat lots of fiber. Sometimes with prolapse and even leaking urine, losing weight can significantly improve these symptoms. This is because then there's less weight and less strain on these pelvic floor muscles. Trust me, losing weight is going to be extremely beneficial. Doing things to improve your core muscles. So exercises like yoga and Pilates, which really focus on the core, actually help strengthen those muscles, and it's going to improve symptoms. This is also similar to my pregnant patients. I also recommend yoga and Pilates because we know that pregnancy can weaken those core muscles. So again, you're just strengthening them back up to help prevent anything from happening. Now again, there are other options that may be slightly more invasive, things like a pessary or surgery. If you want more detailed information on what that entails, let me know in the comments and I'll film it for you. And number 5, get a referral for a urogynecologist. As a generalist OBGYN, I know how to identify and diagnose pelvic organ prolapse. But like I mentioned earlier, there are urogynecologists who subspecialize in this field and treat this all the time. So whenever I see a patient where I see it's a significant prolapse, automatic referral to urogyn. Or you may just want to get a referral to get their expert opinion. No offense, obviously they went to 3 more extra years of schooling for this. So advocate for your own health. That way you get the best treatment. All right, everybody, I hope you enjoyed this video. I hope you felt a little bit better if this is something that you're struggling with, or that I at least gave you options on things to try or when to go see your doctor. I'm gonna leave linked here the video I filmed about labioplasty. This is, again, another topic that women may not feel comfortable, or maybe they feel shame about something like this. So I want to keep these conversations going. This is our body, this is your health. You need to be your biggest advocate. Never feel embarrassed about something like this. We are doctors and we are here to help you. And like I said, you need to take care of your own body. I hope I have provided that encouragement to you. All right, everybody, that's the end of the video. I hope you enjoyed it. I will see you in my next one. I love you guys. Always remember to be kind and show love to everyone around you. Bye.